All right, good afternoon. Thank you everybody for joining us today. I appreciate you taking time and welcome. This is our second Northern Colorado Healthcare Careers live virtual chat. Our focus today is looking at healthcare programs, internships, work-based learning, apprenticeships, and our event is hosted by the Northern Colorado Healthcare Sector Partnership. And we'll put that email in the chat box if you have other questions. What our partnership does is we bring together key stakeholders to promote and improve health within our communities. And we really focus on industry at the forefront. We collaborate with educational providers, both 2-year, 4-year institutions, workforce development, economic development, and other community partners to seize opportunities to respond to the changing healthcare environment, which we've seen a lot over the last year, and to really look at solving collective problems and celebrating successes in our region. My name is Chris Houston. I work with Front Range Community College as the Director of Healthcare Apprenticeships. I work college-wide on all 3 of our campuses from Larimer down to Westminster. And I'd like to have the panelists introduce themselves. William, we'll start with you.
Good afternoon. My name is William Murphy. I am the Sterile Processing Manager for Boulder Community Hospital, as well as the lab instructor for the Front Range Community College Apprenticeship Program. And welcome. I'm glad to have you here.
Thank you. Angie.
I'm Angie Peach. I am the Medical Assisting and Phlebotomy Program Director for the Larimer campus. And I work with apprentices and traditional students of all ages, and welcome.
Thank you, Angie. Sid, welcome. I think you're on mute, Sid. You need to unmute yourself so we can hear you. It's okay. Down on the left.
Right. Good
there
deal.
You go.
Okay, got it now.
Wouldn't be a Zoom meeting if somebody didn't forget to mute.
Okay. I'm Sid Springer. I'm with Home Care of the Rockies, non-medical home care provider, and a Apprentice USA sponsor through the I can't think of the agency now.
Department of Labor?
Department of Labor, yeah. There we go. And glad to be here and welcome to all of you.
Thank you, Sid, for your time today. And I just wanted to let our participants know that we are recording our session today. We do have a moderator and we do have the ability to answer your questions. You can either raise your hand and we can unmute you, or even better is to utilize the chat option, which is at the bottom of your Zoom meeting, and feel free to type questions into the chat box. I will take some pauses and Sarah Rice will be moderating that, and we can answer your questions. All right, so I will get started. We did talk a little bit about where you work in your, but I wanted to talk a little bit about these opportunities for work-based learning, apprenticeships, internships. So Sid, you had mentioned that you are part of a registered apprenticeship. Maybe tell us a little bit about what apprenticeship opportunities your organization provides.
Yes, we have developed our own educational program, which consists of 100 hours of training for caregivers. That's a mandatory for every caregiver that goes to work for us. With the apprenticeship program, we work very closely with the workforce people in really a 6-county area. We're headquartered in Boulder County. Our offices are actually halfway between Longmont and Boulder on the diagonal highway. As people come to work for us, if they are vetted through workforce, there are funding available through some of the workforces from time to time. It's not a steady thing. Some have it, some don't have it. And it varies on what is available. If those funds are available, we are eligible when we hire someone who is vetted and is in the program through workforce to receive funding for their education, dollars and cents wise. So that's something that we strive to achieve, is to have as many as we can coming through the program on that basis. The education program that we provide takes roughly a year for a person to go through it. And we tie the caregiver's wages to the education program, in that as a person goes through the program, each 25% that they complete, they get a $1 raise. And I'm not even sure right at this moment what our starting rate is. I think it's either 13 or slightly over $13 an hour. But this provides a person with the opportunity to be up in the $17 to $18 per hour income level. We do have a complete slate of benefits available after an introductory period of time expires, which we have a full offering to give someone who is interested in taking this first step as what we feel like is the first step on the ladder in medical care. We are non-medical, but we are a stepping stone for people who want to get up into that. We're very proud of what we have to offer, and feel like it's a one-of-a-kind educational program that is fantastic. The people who go through the program are really trained to be a, quote, professional, very professional caregiver, and that means a lot.
Thank you, Sid. I noticed that Sandra just put in our chat box for those listeners some information about the department, the Bureau of Labor and Statistics, which provides job tracking data. And as we know, with an aging population, there's a lot of jobs in this home care area. And the apprenticeship opportunity, Sid, sounds like a great way that interested job seekers can actually learn about the trade at the same time they're earning a wage.
That's very true. This is a change that took place with us developing this education program. And as far as I know, I don't think there's anybody else has anything just exactly like we have. Most education, it seems like, in the caregiving industry is done online. And we all know that that is not the most efficient way to learn. It saves time and money, probably, from the long run. But the education level from a classroom standpoint that we provide, hands-on training by professionals, RNs, teach a lot of our education efforts. We have a lady who teaches their lessons dealing with Alzheimer's and dementia, who has roughly 40 years of experience dealing with that. She is an absolute walking encyclopedia. And with the complexities that have been brought about by dementia, Alzheimer's, and other extremely difficult situations of both mentally and physically, a person can't just come in off the street and become a caregiver,
Right.
And be qualified to take care of those types of people. And our education program does provide the training to do that. So it's a great program,
Angie, thank you, Sid. Angie,
Yeah.
maybe you could talk a little bit about both your traditional model, and then, as Sid was talking about, the apprenticeship model that Front Range is in partnership with Associates in Family Medicine.
So Front Range, for the medical assisting program, has two kind of pathways that students can go down. And one of them is a traditional pathway where they may take some classes online and they come onto the campus for others to learn hands-on skills and to participate in their education. And that's that just changed. It's a 26 credit program. It can be completed in 2 semesters. So students generally start in the fall and they finish in the spring. And they're ready to work and sit for their national exam after the end of that program. As part of that traditional program, those students participate in an internship opportunity. And that internship is 180 hours. So it's done over 5 weeks. It's basically 5 weeks of full-time employment. And those students learn learn their skills on the job. They help to kind of reinforce what they learned in the classroom. They work alongside a lead MA or a registered nurse or an LPN, and they get to see patients and do room intakes, administer medications, do all the things an MA would do with supervision. But those internships aren't paid. Traditional internships are not paid for traditional students. An apprenticeship is a little bit different. That pathway, when a student goes down that, there's kind of a couple different ways they can get to it, but when they get to that apprenticeship and they're accepted into that opportunity, that's not a decision that the college makes on who gets to participate in the apprenticeship. That's a decision the employers that host those apprenticeships get to make, because they're bringing that person, that student, into their employee. So they want them to fit in with their team, and they want to make sure that they've interviewed them and that they have a good rapport with that student, and that the student is going to be really successful in that apprenticeship. And what the student will do is they'll still keep taking a couple of classes on the campus with us at Front Range, but they'll also then be working, and they'll be paid as part of their apprenticeship, and they'll learn skills on the job. So they'll be, while our students in the classroom in the traditional program are learning how to do vitals and intakes on a patient in the classroom and simulation, the students in the apprenticeship part are in a clinic learning those skills with real live patients and alongside a registered nurse or an LPN or a lead MA. And they're being paid to learn to do that. And it's a really kind of a neat partnership, because what the college is then able to do is to award those students credit. So prior learning assessment, or PLA credit, and the student still graduates with their certificate from the college, but they also got paid to participate and learn on the job as part of an apprenticeship. So they get to kind of do both paths at the same time. And those are really unique experiences for our students. They're really engaging and interactive, and we wish all students could participate in an apprenticeship. If I had my way, every student would participate in an apprenticeship, but unfortunately there aren't enough apprenticeships out there for every student to have that opportunity. And so there is a traditional college path that you can do, and you can still reach the same end product. And that's kind of how the two models work. And so our apprenticeship partnership on the Larimer campus is with Associates in Family Medicine. And they have a clinical educator who's a registered nurse who works with their students. And we've had that apprenticeship for 4 years now. So it's been a really successful partnership. And we've had some really great students who still are with Associates and have continued on with their employment with them after they've completed their apprenticeship. And those are kind of the two paths that we have.
Thank you, Angie. Both sound like a great path. And just to note that Front Range has recently reduced the number of credits to complete that medical assisting program. So I'm kind of compressing that into a 2-semester. So thank you. William also works in the apprenticeship model, working with Centura Health and with Sterile Processing. William, would you like to tell us a little bit about how those students complete their apprenticeship and their related instruction?
Yes, thank you. Our apprenticeship model through Centura Health and our partnership with Front Range really does support our apprentices, like Angie's course as well, and our traditional students by providing hands-on learning as well as online education as well. We provide in-class lecture to go over and reinforce the learning that they've done online, as well as get into an actual working department. So working with steam sterilizers, hydrogen peroxide sterilizers, the machines that they would do their job with. We found it was very vital for them to be able to do the job, to be able to touch the machines, to go through and utilize all of the instruments in their career. We step side by side with them. With our traditional students, they go through the same 16-week course with us, and then go on to an externship or internship for 400 hours. It allows them to get all of the required hours necessary to sit for their national exam for their certification. For our apprentices, they are part of Centura from the very beginning, and they are connected directly with a preceptor who is a educated certified technician in their department with years of experience, as well as an entire department of skilled employees and associates to help guide them through their 16 weeks, and 400 hours of contact time for a full-time employee, to get them ready for their certification test as well.
Thank you, William. And William, I know I've worked with him directly. Just to highlight, that program has a 100% pass rate on their national exam, both pathways, as Angie mentioned, the traditional and the apprenticeship. I think the benefit of that apprenticeship is they complete sooner and they're being paid for those clinical hours. Like Angie mentioned, in the traditional model, which we use as kind of our other option, students aren't paid for those hours that they have the externship. But as Angie mentioned, we're trying to get as many as we can. Let me pause for a minute. Sarah, are there any questions that are coming up in the chat?
Yeah, there's actually one, perfect timing. This is from Liz, and her question is, if we are interested in apprenticeships, what would be the first step in order to move forward into that field or that area?
Let me start with an answer and then I'll hand it off, Angie, to you. So Front Range Community College has an information session about apprenticeships that are partnered with our institution. And Sandra, if you're able to find that on the Front Range website, you can put the information for the apprenticeship landing page in the chat box. We also, Angie, do you want to tail off of that? What other opportunities students have to learn about apprenticeships with our institution?
Yeah, so I would say that the first thing to do is to kind of decide a pathway of what you would like to do in healthcare. And sometimes that's meeting with an academic advisor. Sometimes that's reaching out and kind of just doing a little bit of independent career exploration. And once you decide which pathway you would like to go down, seeing if there is apprenticeships in that pathway. Because for some healthcare fields, there are apprenticeships and for some there aren't. So for example, medical assisting has an apprenticeship pathway, but phlebotomy does not. So you just need to kind of decide which one you're in and if it has one to start with. If it does, it will be listed on the Front Range website. It'll be part of that program's information. There'll be a statement saying that this has that. And the best thing to do in that program is to contact the program director and start kind of saying, hey, I'm interested in your program. What apprenticeship opportunities do you have and what do they look like? Because for every program, they're a little bit different. And so you want to make sure that, for example, on the Larimer campus, and I'll kind of speak to the Larimer campus because that's my home campus, our apprenticeship, the students start in the traditional pathway. And about halfway, a couple of months into their program, they start interviewing for those apprenticeship positions. And then the students who get accepted into the apprenticeship, they move into that pathway and I help them make sure Chris and I actually both kind of get all their paperwork and everything done that needs to happen. And for the students who don't have that opportunity, they stay in that traditional pathway. And so you would kind of get there based on where you start from. So I always say reach out to the program director, but start on the Front Range website, look at those apprenticeship opportunities. Also, the Department of Labor has a great list of apprenticeships throughout the whole country that tell you, here's all the opportunities, and you can look by your state and your county and your region and your what you want to go into, and that's a great way to start too. But not every apprenticeship, not always, how do I say this? The employer doesn't always want you to contact them. They want you to start kind of where the education starts and then kind of work to where you need to get to.
Thank you, Angie. And I know Sandra did put the Home Healthcare of the Rockies Apprenticeship Program website in the chat box as well. But Sid, do you have anything else to add about how people can get information?
Well, the best way to get information, first of all, would be to contact through Larimer County Workforce in Larimer County. And if someone is in a different county, just go to the county workforce that they reside in. And the thing to do would be to seek information as to whether or not they have a vetting program for caregivers that they would go through before referring that caregiver to us. Also, we have a website, which is, it's pretty easy to remember. It's just www.homecareoftherockies.com. That allows someone to go online, fill out an application online with us, and then it's processed from that standpoint. We have regular classes. We have to have introductory classes with a short amount of training in order to get a caregiver to the point where they are ready to, what we call shift ready. We're not connected with the community college system yet, and I emphasize that yet. There is work being done on the state level that we are very hopeful that will reach the point where our education program will somehow, and I have no idea how this will work, become a part basically of the community college system. But the key thing is, it was mentioned earlier, there is an extreme shortage of personnel in this area. It's scary the way we see turnover happening. We thought this education program would cut down drastically on our turnover rates, but I'm not sure what the COVID thing has done to that, but it seems like the turnover rates have skyrocketed in the last year. And so this is something that where everybody in our industry is fighting. We are all scrambling for employees. We need them desperately. We have, generally speaking, we have more clients to take care of than we have caregivers who are available. And because of that, we have connected ourselves with other people in the care industry to the point where we don't tell people we can't take care of you, but what we say is we have someone else we'd like to refer you to that hopefully they can take care of you, So having that kind of a network is super important in our industry, and we're pleased to have that.
And I thank you, Sid, and I think that just highlights a lot of the people who are looking for jobs. I mean, healthcare has been very stable during COVID. I know there has been turnover. People have had to make changes based on childcare and things like that, which I'm sure impacted you. But overall, it's been probably one of the most stable industries during COVID. So I'd like to move on to our next question about how would you recommend students get experience in these careers? So, William, I don't think a lot of people even know what sterile processing is. Any advice on maybe you could just tell us just very shortly what sterile processing is and how would a student get some experience in that field?
Definitely. Sterile processing is in line with our surgical department. A lot of people say we are the heart of the hospital because we do reach out to every single floor in every room of our hospital. We are not clinical. We will never see or touch a patient, but everything we do directly affects their outcome. Sterile processing is responsible for the sterilization, decontamination, and processing of every instrumentation used in the hospital, from a simple Adson forceps, which is like a tweezer, to highly developed scopes for endoscopies and colonoscopies. So from the smallest to the very largest instrument, we're responsible for ensuring that we are meeting the FDA and AMI guidelines for reprocessing those instruments. So it is very necessary for us to have highly skilled and educated individuals to do that job. As a first step, would be great to reach out to a local hospital and directly talk to a sterile processing manager or supervisor and ask for a job shadow. We love to have people experience of what we do. It gives you an idea if this is going to fit in your life, if it's for you. We do deal with body fluids and bioburden. So we want to make sure it's a good fit for you. So reach out, contact a local hospital or surgery center. We would love to have you come through our doors.
Thank you, William. Angie, any advice that you would give someone in learning a little bit more about how to get experience as a medical assistant?
Yeah, so I would say a little bit of it is age dependent. And so if you're still younger and you're still in high school, I would reach out to your high school counselor and see if you can work in whatever healthcare career pathway that high school has, because I think that gives you lots of exposure to lots of different healthcare programs. The other thing that you can do is really just reach out to people that you know who are working in healthcare. So if you go to the doctor, next time you go to the doctor and you talk to the person who takes you back to a room, ask them what they do. Ask them about their job. Ask them if they like it, what they like about it, and what maybe is their biggest challenges in it. And really just kind of contact and get into conversations with people about healthcare. I think that's a really fundamentally strong thing. The other thing that you can do is reach out to your workforce center in your county, whichever county you reside in. They have great tools and great screening tools and evaluations to see what would work best for you. Or reach out to any of the community colleges in your area. Their pathways advisors or advisors are going to have kind of the ability to show you those learning spaces on their campuses. They're going to have the ability to introduce you to faculty and staff who work in those departments, so you can have conversations with them. And really, it's just about making connections and starting to have conversations. So any way that you can do that is the way that you want to start.
Thank you, Angie. I have noticed also Front Range did produce some career awareness videos that are on YouTube. If you type in Front Range and medical assisting, Front Range and sterile processing, you can see those as well. Sid, how about from your perspective, home health care? How can students who are interested in that maybe get a little bit of experience of what that job is like?
Well, we don't have a situation where we just take people and let them, follow another person along and that sort of thing. And it's understandable because, first of all, to be associated with any of our care clients, a caregiver has to be vetted, and we are very diligent about that. But the key thing is we run this in our recruiting program. We have almost weekly situations where a person can come in to our office and spend basically a whole day with a kind of an indoctrination, if you will, into what caregiving is all about. And some people come in, they go through that, and they say at the end of the day, this is not for me. I thought maybe it was, but it's not. And if a person goes through that, then they can move from that point to becoming an employee. They go through the entire vetting process and what have you that we do, and then begin their actual training. And after an 8-hour training program that we put a new person through, we can put that person out in a situation caring for a client where companionship is the only thing that they're doing, basically. We grade our client levels into 4 categories. We grade our education level for our caregivers into 4 different categories to match those of the clients. So we make a huge effort to try to match up clients exactly with the caregiver level that they need to take care of them. But, the key thing is, this is like anything else that is an unknown to someone. You pretty much have to try it to kind of find out, are you going to like it? Unfortunately, we have a big turnover of people within the first 3 months, it seems like. Even though we try to get people indoctrinated about what they're going to have to do, we still find that in that first 90 days of an employee is working for us, that's the biggest turn time. because it's not unusual at all to have somebody that's been working for 2 months and all of a sudden says, this is not for me. I'm going to move on, you know. And a lot of people also, there's been I think COVID has really had an influence on this. There's a world of people who've had family members that required their attention. And some of those required the person to move across the country to take care of a relative. And that's been big. And it's been scary, dealing with the COVID issues. We've developed special COVID training for all of our caregivers, and we provide all the PPE equipment that they need to be safe in their own rights and be safe where our clients are concerned.
That's great that you've been able to provide that. You know, one of the focuses of our discussion today is this concept of kind of a work-based learning. Angie had mentioned that there's pathways within her program, either a clinical or externship or an apprenticeship pathway. Angie, can you talk a little bit about why is that so important in these healthcare jobs to have that work-based learning?
I will say that the most important piece of any student's education is not necessarily the textbook and the lecture that they sit in front of in the classroom. There's kind of a need for that, but it is not the most important piece of their education. The most important thing that they can do is to be in the clinical setting or in whatever healthcare setting they're going to be in front of the work that they're actually going to be doing, whether that's patient care or non-patient care, and actually interacting with the people who do the work, seeing what real life situations look like and how they differ from a textbook, and how to go about approaching just the humanity of healthcare, just the people aspect of it. Because even if you're not working in direct patient contact or direct patient care, what you do impacts people. So just being able to get that hands-on experience is not something that we can recreate in the classroom. As much as we can have, you know, brand new buildings and $100,000 pieces of equipment and all of those things, it's not the same thing as being with a real patient or being in a real healthcare setting. And the concepts are kind of there, but the ability to relate and experience it are truly what matters. And that's why it's really important that in any education that you do in healthcare, you have that opportunity to either participate in an internship or externship. It's the same thing, just different word for the same thing, or an apprenticeship, so that you get that on-the-job learning and you get that real life experience to say, you know, this happened and this was the result of that.
I think that's a really good point. And you mentioned that even in roles that don't have a patient care setting, and maybe William, a patient forward setting, you could expand on that. In your experience in working with students as they do their apprenticeship in the real SPD department, prepping and packing and cleaning instruments, how has that impacted their experience in learning?
I can just attest to exactly what Angie said. It's you learn so much from the books, from the lectures. You take that in and you make that part of you. But there's something different about walking in the shoes of the job you're going to do. With these apprenticeships and externships, you're allowed to go in and work with the instrumentation that you're talking about, that you're learning about, that you're remembering, putting your hands on them. We have so many different styles of learners, from people that can learn just from a book or hearing it, but most of us need to touch it. We need to go over it. We need to do it again and again, or have someone explain it to us while we do it. You learn so much by being in the department and actually doing the job and walking in those boots. You know, with decontamination, actually being in the water, making sure that you're seeing the debris, removing it from these instrumentation. That's not something we can really teach you in the book. We can tell you why we're doing it. We can tell you those steps. But when you actually physically have to do it again and again and repeat it and learn that process, it's so valuable. I don't think anyone going into the field and just having the certification would excel as much as our apprentices and our students have. the students that we currently have out there right now and our apprentices from previous classes are shining examples of raising that bar of what sterile processing technicians are. We have many of them who have started with our very first semester who are now part of our program, who are helping teach our next generation of sterile processing techs. So having that hands-on learning from experienced people is so valuable. It is absolutely so valuable. And to get paid while you do it, even better.
That is one of the benefits of that apprenticeship model. That's
is.
true. Sid, do you have anything else to add about the benefits? I mean, I know you had mentioned before that you include a lot of that hands-on learning. What have you seen as some of the benefits of really getting in there and understanding that job hands-on?
Hey, nothing can take the place of actually being there. I agree with what you just said, totally. We don't train our caregivers and then throw them out to the wolves. We have a support staff that is second to none in the industry as far as home care industry is concerned, nurturing and mentoring caregivers as they grow. And there are things that you can try to do it in a book form type thing and learning that in certain areas that all you can do is kind of skim through it. But when they encounter these things out there dealing with an actual client, a lot of times that's when the phone rings back to a supervisor and say, "Oh my God, I'm doing da 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 da. What do I do?" We have support. And that's one of the things that we stress to our caregivers who come to us, is that they can depend on having support from us as a team. And we have an office team that is absolutely great, I think, at dealing with the needs of our caregivers and dealing with the needs of the clients at the same time. So that's something that someone can expect with us. And that is an expectation that will be met here.
That's great, Sid. I think you bring up the concept in the apprenticeship model. The word that's typically used is a journeyman. I think the word that we more commonly associate now is a preceptor or a mentor, somebody that's, explaining what the real life work is like. What, Angie, I'll come to you. What advice do you have for students on how to really maximize their opportunity, whether it's in an internship or an externship or an apprenticeship? How can students maximize their work-based learning experience?
So I will say that professionalism matters the most. That's one of the statements I say over and over and over to every one of my students and every kind of individual I've trained over my career. And it really is about showing up with all those soft skills, the being on time and good customer service and appropriate interactions and all the things that are really, you can't teach somebody, they kind of just innately know. And getting in the door, and once you're in that door, making sure that you are taking advantage of everything that's being put in front of you. You're taking notes, you're asking questions, you're following up with things, you're checking back in if you don't understand something, or you're asking to see more, I think is always such a great thing. I always say for students who are interning or externing or apprenticing or on the job learning, you should never be idle. There's always something to do in healthcare. So it doesn't matter what it is. It may be cleaning a counter, but you should always be doing something because there is knowledge to be gained from whatever that is, because it all contributes to patient care, even if it seems like it's something really, really trivial. And just making sure that when you're there and you're with your mentor, whoever that may be, that you are taking as much advantage of that as you can, because you ultimately are the one who leads your education. And so your mentor is there as a great resource and they have all this knowledge, but unless you're actively seeking that from them, then you're not going to get everything out of it that you could. And so I think that is probably the biggest thing is excessive professionalism, always staying busy and asking questions, and really trying to make sure that anything that your mentor has to offer you, you're trying to seek that out and get that knowledge from them. And so I think those are kind of the biggest things that you can do.
Yeah, I agree with those. William, I know you have directly been a preceptor for an apprentice. Can you tell us a little bit about your experience and how can students maximize that?
Yes, I couldn't say it even better than Angie. Professionalism is key. Showing up on time, being available to learn, being willing to take that next step is ultimately the best thing you need to be doing in your apprenticeship or externship. As a preceptor, that's something we want. We want to have that student or apprentice wanting to learn, wanting to be active, want to participate in their learning process. If you're disengaged and you are standoffish or don't want to try something next, it may not be the role for you. And we give you that opportunity through the education and the course to say, you know what, I've met my limit. This isn't how far I can go. But if you're willing to do it, we're going to keep you going. With our programs, we do offer, with the SVD program, 18 credit hours, which you can use to go on to your next education, your next step in your healthcare career. Sterile processing really is a stepping stone, just like many of our opportunities, to go on to surgical technology, to move into nursing, even surgery, become a physician, take care of our community even more. This is really just a stepping stone for you. And by being there, being professional, being willing to learn, it's going to get you to the next stop.
Thank you, William. I remember one of the preceptors I was working with say that they don't like to hear their apprentices or their externs say, oh, I already know that, because you may have learned it in the classroom, but you probably don't know what it's in real life. So I always remember saying that. Sid, do you have anything to add to how to really maximize those experiences?
One of the things that I failed to mention earlier is the fact that we pay our caregivers while they're in training. When they're in classes, they're being paid. They're not off payroll. We have a program that we work very hard to achieve where a caregiver could have a planned shift with a client, and then they have this education event that's going to be a half-day program that they need to be in. We work out getting someone else in there to cover their shift, but we pay that caregiver their wages while they're in the training class itself, which is rather unique. And I'm not going to say this just to brag about what we provide. The education amount, dollars and cents wise, that we provide for a caregiver, the cost factor on that is $2,700+ per caregiver. That's a lot of money to invest. And we feel like this is a very solid investment to make. The caregiver does not have to pay 1 cent of that. And the only time we ever get any reimbursement for education is when funds are available through the workforce centers for paying for apprenticeship learning. And that's there's been a very small amount of that over the last 3 years since we've had this program in effect. But I just say this, we have been a stepping stone for many individuals who have come into work that have moved on up into nursing and this sort of thing. And we are delighted to be classified as a stepping stone in the industry.
Thank you, Sid. And I think that, again, that really highlights the benefit, as Angie mentioned, to those apprenticeships is the opportunity to be paid while you're learning. Sarah, are there any other chat questions?
There are not.
Okay, we're going to wrap up. I'm just going to go around. So if you're thinking of any questions, now is a good time to ask them. If you need any other contact info, please put that in the chat box and we'll get that for you. So in just wrapping up, Angie, just, looking at job seekers wanting to get into healthcare, what advice do you have for those individuals?
I think for anybody who is interested in healthcare, I think it's all about getting started. And it doesn't really, as you kind of probably heard in a little bit in here today, it doesn't matter where you get started. in healthcare. It's just about getting started. So whether that is an entry-level position doing home healthcare, doing any of these CTE programs like medical assisting or phlebotomy, or a 5-credit healthcare program at a community college, just getting your foot in the door is the best way to get started in any way that you can. And sometimes that just means that, you know what, you're going to make the time in your life and you're going to just commit to it for a semester and get it done so that you can get those very first hours. Because I will tell you that one of the things that you will see consistently in anybody you talk to in healthcare is that the majority of them actually rose through the ranks. So they may have started as a CNA and then they became a medical assistant, and then they went to nursing school, or they went to physician assistant PA school, or however they kind of got to their pathway. Not everybody in healthcare, actually most people in healthcare, didn't start out as a doctor. They didn't start out as a nurse. They started in an entry-level healthcare program so that they could experience healthcare, and that opened the doors for them to do more. And so if you're interested in getting into healthcare, really find a good little program and get it done and start working.
Angie, well said. I think that's a really good point. There are so many different types of jobs in healthcare, and some of that initial exposure is just critical to get started. William, anything that you want to add to that?
I think if you're here listening to us today, you're making that first step. I would say follow the links to all the programs that are listed on the chat boxes. Watch the videos on YouTube. Listen to some of the people who've gone through these programs and how it's changed their lives. Like Angie said, we all start somewhere. It's not where you start, it's where you're going. Take the steps, contact Front Range, and take step number 2.
Thank you, William. Sid, how about you? Any last thoughts on?
My last thought, I think, is going to be, I like what William said and what Angie said. We're all in the same boat on this, and that getting started is something that we can be vital for someone who wants to get started. They don't have to have a cash outlay to go get any kind of education. They can get their education here through us, and then if down the road in a year or 2 years of working as a caregiver, they decide, hey, I want to move up this ladder, they have the opportunity to do it. I hope that we will reach a point eventually, and actually, I'm not speaking out of school on this. Governor Polis has seen our education program, and his response when he first saw it was, this needs to be statewide. And we're strictly Boulder County is where we're domiciled. But I think the time will come, and I know there's work being done on this where we will be accredited, and our hours of training and education will be something that a person can utilize to in that step up the ladder. That's not there yet, but I know it's going to happen. It's just a matter of when.
I agree with that, Sid. And I think Angie even mentioned that a lot of the community colleges are learning to using what we call a prior learning assessment so that we can grant credits for work that has been done. So we look forward to hearing more about that. A couple closing items. We really appreciate you joining us today, and we would appreciate your feedback. There's a link to a Survey Monkey that would take less than 5 minutes to complete. We also have recorded the event, and it will be posted, I think by tomorrow, on the NoCo healthsector.org website. And there's also an email there. If you think of something that you need to ask us later on, we have people monitoring that email, and we can get information back to you. So I really want to thank the panelists today. William, thank you for taking the time. Sid, great to hear about your apprenticeships. And Angie, I love that we've got all these different pathways in medical assisting and phlebotomy. So thank you everyone for your time today. I will hang out just a couple minutes to monitor the chat, but if you need to head on, thanks for your time. Have a great afternoon.
Thanks for your asking us to participate. I appreciate that. I'm glad to be here.
Yeah.